Sounds good to me.
Perfect. And we're live now.
Hello, guys. Welcome again. This is Pre-Dent Universe, and I'm Sharita Powers here with Sherry and Tiffany. And I would like to introduce to you today Dr. Asante. She is a general dentist from Maryland, and we are happy to hear from her today.
Hi everyone, my name is Dr. Arlene Asante. I'm a general dentist in Hyattsville, Maryland. Just a little bit about myself. I don't know if we're going to read the bio. I am originally from Hyattsville, Maryland. I got my undergraduate degree at Morgan State University in Baltimore, Maryland, where I got my biology degree. I later went to get my master's at Drexel University in anatomy and pathology. And then I also, during that year, did some research at UPenn, their dental school. I took a year off, started working at a local dental practice in Washington, D.C., private practice. Then I later applied to dental school. Then I gained admissions to Howard University Dental School in Washington, D.C. After that, I did a partial residency program in Maine. And then I started working with a DSO. And today I'm sitting here working with the DSO as well, Heartland Dental in Hyattsville, Maryland. That's a little short but fast description of my journey. I said it so fast, but I know it took years to get here. So yeah, that's a little bit about me. So I don't have a presentation for you guys because I wanted to be more informal, and I kind of wanted to just hear you guys because from a pre-dentalist perspective, I know all you guys are thinking about is just trying to get into dental school. You're just trying to take the DATs, do good on the PATs, what shadowing you should be doing, what should you be doing to make sure that your application looks great. And I'm hoping through this session afterwards, you guys get a better understanding and kind of just talk to you about things that you might see from if you were a new dental student, what are some things that you want to pay attention to your first year once you get in?
Well, what gravitated you towards wanting to be a dentist in the first place?
Okay, so I had braces when I was 13 years old. So I had the whole braces experience. I loved my doctor's office, which was Dr. Scott, which is the funny thing now. He's my colleague. So I actually refer some of my patients to his office. But I started off, just a kid, bad teeth, and went to the dentist's office. They were so nice. They were fun to be around. I just enjoyed my experience. And I told the dentist, I said, hey, I would love to be a dentist. Did I know what I was getting into? No. I just knew I loved dentistry. I loved how my teeth looked afterwards, and I loved the office. So I started working there in the dental office as a sterilization girl. So I was just sterilizing everything, and then I would just help with the anything that needed to be fixed. As far as the charts, back then they had paper charts. Fixing up the charts and just being friendly. And I told myself from there, I told the doctor, I want to be a dentist. And, he was just positive and just, he went to Howard as well. And he kind of just gave me positive feedback and told me you should definitely do it. So that's how I became into wanting to be a dentist. But I definitely would say my pathway to dental school was not straight. It was definitely a lot of bumps and roads. I didn't get in the first time. I applied twice. So I always tell people, if you get rejected the first time around, if you really want to do this, still apply again. Don't let the first rejection be something that deters you from getting into dental school because it's very competitive, and just because one year might not be your year, it can always be another year for you.
Do you have any advice for students that have to reapply if they don't get into the first time? And do you have any advice for students that are taking the DAT?
Oh, yeah. So my first advice is for someone who's reapplying is whatever school you like the most, your top school, call them and ask them why you didn't get in. Don't call all the schools, just your top schools, maybe your top two. Ask them, well, why you didn't get in, and what about your application you can strengthen. So when I didn't get in the first time, one of the issues was my GPA was very basic. I think I had a 3.2, and then also I had some shadowing experience, but I had nothing to set me apart. I was just a basic student. And then, so what I did is, University of Maryland College, University of Maryland Baltimore was my top choice. So I called the recruiter there, and she was so kind, so nice. She was like, you really need to boost your GPA, and then you also need to retake the DAP. And then my mentor at that time told me, you should really do some research. That will really look good on your application. So I decided to get my master's, and then so that's when I started doing research at UPenn in their dental school. So that really enhanced my profile, and then also the research that I was working on, it got published. So that enhanced my profile as a student immediately. Then in addition, I have a master's now, and then my GPA went up to a 3.5, and then also I did much better on my DATs. So my advice to someone who's applying again is you have to make your application look above anybody, above average, whether it's doing a mission trip in Africa. As a pre-dental student, there's a lot of opportunities for you to do mission trips. Like, that's something that will set you apart. Or just doing something that you love doing. If you want to do a study abroad program that has nothing to do with dentistry, that sets you apart. Of course, shadowing is really important. So find something that will set you apart when you're applying the second time around. Because they want to know, okay, so you applied again. What did you do differently? What did you learn? That's the biggest question they're going to ask you. What did you learn when you're applying the second time around? How did this 1 year break that you had to take because you didn't get in, what did you do with that spare time? So they really want to see that you were motivated to apply again and that you were determined to get in. So that's definitely my advice for if someone's applying the second time. As far as the DAT, you need to study. I mean, you have to study. I know people that want to go to professional school and they're like, yeah, I'm going to study, but they study and then they're still going out to the club. They're still going on vacation. They still have a social life. When you're studying for the DAT, you have no social life for at least 3 months. I mean, depending on how you decide to study. I know for me, I think I studied for about 3 months. Of course, in the beginning, you're trying to organize your cards. You're trying to figure out where your weak points are. You're trying to organize everything for the first couple weeks. And then, you have to get a rhythm of figuring out where your weak points are, your strengths. And I know the 3D dimension part, I think it's the PAT. It's very, it's a whole different world. It's something you don't really learn on a day-to-day basis. So starting from scratch, I remember Crack the Dat was something for me when I used. I don't remember what other. Kaplan was something I used. Princeton Review I used. So definitely really studying and really isolating yourself. Unfortunately, you have to isolate yourself and really study and take it seriously because you don't want to half-ass it. Sorry for cursing, but you don't want to half-ass it and put all this semi-time into it and just to find out that you didn't get in.
Besides doing research and doing a master's, for those who don't want to take that route, do you think there are other ways to enhance your application?
Absolutely. So I had colleagues that went to hygiene school. Everyone's different. Like, you got to figure out what's good for you because, for example, one person, after they applied under undergrad, finances was the issue for them, paying their bills. They had a family. So they needed something where they know if they didn't get into dental school, they have a backup plan. So one person I do know, they ended up going to hygiene school. Started working for a couple years and then they applied to dental school. If that journey is okay for you, absolutely try that way because you also look like a stronger applicant, especially if you're working in the field and your boss, the doctor that you work with, can give you a recommendation. So hygiene school is an option. Also, DA school, dental assisting. I know some people that went after they didn't get in, they decided to be a dental assistant for a couple years, and then they applied again. So there's other ways to enhance your profile, because if you already are in the field, they know that you're dedicated to the field. You already have a basic understanding of the science behind dentistry. So that also makes you look good as an applicant. And also, don't be a square. Like, do other things outside of dentistry. Get involved in clubs, volunteering, community work. I know admissions really like that you're a well-rounded student, that you didn't just do dentistry all day and you have like a 4.0 and then you have like a 22 on the DAT, but then you have no social activities at all. So just making sure that you're a balanced, well-rounded person also looks good as well.
Thank you, Dr. Asante. What is the hardest thing that you find as you work in the office, like while you're practicing? What do you think is the hardest thing?
Oh, as a dentist?
Yeah.
Oh, okay. That's a good question. Hopefully my colleagues won't see this, but I'll probably be as honest as possible. I would say patient interaction and staff interaction. And any dentist you talk to, once you become a dentist, I swear, your headache, dentistry is 5% of your headache. 5% out of 100%. 5% will be dentistry as your headache. Because once you finish dental school, you're skilled. You could do it. You could do all dentistry, essentially. You're a smart person. You learn how to learn on your own. You're a self-learner. You're a self-teacher when you become a dentist. And that's what dental school teaches you, how to be a self-learner and teacher, and how to learn on your feet and by yourself. So when you get out of dental school, any skills that you need to enhance, you'll be able to, because of that education you got in dental school, you know how to teach yourself, master your skills. So 5% when you're a dentist is dental issues, like actually the skill. The other percent is pretty much staffing, and then also dealing interpersonal skills with your patients. Because if you're not able to communicate to your patients what is going on in a very layman's term, which means a 5-year-old can understand it, you will lose that patient-doctor relationship. Then your staff, unfortunately, because of COVID, the economy is completely different. People are not working as much. Dental assisting is a hard job because the dental assistant has to learn how the doctor works. Every doctor works differently. We're doing dentistry, yes, but the way I do a filling and a way another doctor does a filling is completely different. So I think one of the hardest things is just relationships with your staff, your patients. It's probably the thing you're really going to have to learn how to juggle the most.
Thank you. So, one question that I have for you today is, what did you find one of your biggest struggles? That could be currently working as a dentist now or in dental school that you faced being a ethnic woman.
Oh, wow. You have to be confident. You definitely have to be confident because people are always going to question your diagnosis. People are going to question why you say the things that you're saying as a dentist, even though the information is out there. I think being confident in dentistry is the biggest thing. Unfortunately, dentistry is a very male-dominant career or path. So I work with a lot of men. I think because I've been a dentist, most of the people I've worked with were men. So you have the sexism thing going on, but then you also have, the racial thing going on. Ageism is real. Ageism is real. Gender issues or conflict is real, and racism or culture differences is real too. And for me as a clinician, I have to be open to other people's different diverse backgrounds as well. I have that open mind, but unfortunately, some people don't. And as a dentist, I have to always be confident in who I am and why my dentistry and my philosophy in dentistry. And remembering that some people may not have that same open mindedness as I have, that doesn't mean that I have to stoop to their level. As Michelle Obama says, when they go low, we go high. So I always try to remain, compassionate, understanding, and give people grace. And always remaining humble and realizing that some people just don't have that background as well. But I've met some awesome people in all different diverse backgrounds, to be honest with you. I've met some awesome people, but there's always that one or two people that might rub you the wrong way, but I don't charge it to their heart. I just realize, this is an opportunity for me to educate. There's an opportunity for me to enlighten. It's an opportunity for me to stand my ground and still be confident.
Thank you.
And following up on that, how would you deal with difficult patients?
So I learned this from one of the doctors that I used to work with. In the beginning, when I first started in dentistry, I used to be not necessarily scared, but just kind of like, I don't know what's wrong. Like my mindset when someone's like yelling at me, I'm like, I don't know what's wrong. But honestly, when I have a difficult patient, my mindset is, how can I win them over? That's literally my mindset. How can I win them over? And I have used that mindset, and it has helped me win them over. So when you come into the operatory room, I know they're upset. How can I win this person over to be happy with me as a doctor and trust me again? Because a lot of times when patients are angry or upset, they lost trust in the doctor or they lost trust in dentistry. So you have to re-equate that relationship in order for them to regain your trust. Because I have difficult patients every day. But when they see that you care, that you're interested in them, they tend to soften up a little bit. I've had one patient say to me, I really have a bad attitude, but you just bring out the good side of me. And I'm like, okay. So going with the mindset that I can convert this patient over to a happy patient and being very driven by that can actually go a long way. Instead of going in scared and, oh my God, I don't know why they're upset. That can change the atmosphere when you go in with that mindset. And then also realizing sometimes it's not your fault. Some people just really are having a bad day. And as a doctor, you need to always be able to control the room, control the atmosphere, and being able to enforce your personality into the situation. Because most dentists have good personalities. Of course, there's some rotten apples, but overall, most dentists are really cool. They're really laid back people. So using your personality and your social skills to help win the patient over, and then listening to the patient. A lot of times, if you take the time to really listen and try to address that need, you will be able to convert that patient over to a happy patient. I mean, they're people. Sometimes you have to remember that as a dentist, these are people. Like, let's take the dentistry out of it and just talk to a normal person. Like, if it's an older person, just think of them as your grandfather. If it's a younger person, just think of them as your little sister. And talk to them how you would talk to your little sister when they're mad. Respectfully. You still respect them as a patient, but trying to get to the root of the frustration or anger. It goes back to just listening.
Kind of segueing from this topic, when you were applying for dental schools, besides Maryland, how did you narrow down what dental schools you would like to apply to?
Okay, so I based it on my DAT scores. I based on where I was, my average, and I looked for schools that were looking for that. I also based it on location, where I wanted to live for the next 4 years. Um, and I also based it on what the school was known for. Like some schools, like NYU, I don't know if it still is now, so I don't want to give wrong information. But when I was applying for dental school years ago, so I don't know what it is now. NYU is known for research for sure. Um, so I knew I didn't want to go there because I did not, even though I did research, it wasn't my thing. Then I also looked at, okay, do you want to go to oral surgery school? Do you want to go to PROS school? You might want to go to a dental school that has maybe a PROS program. You might want to go to a dental school that has an OS program. So in case after your 4 years, if you wanted to do their PROS program or oral surgery program or PEDS, it'll be easy for you to apply to that school. But also, maybe days when you're not busy in the clinic, you can shadow in the OS department. You can shadow in the PROS department, PEDS, ortho, all the specialties that they have. So I would think about that too. You might not get into that program that you went to dental school in, but you might be able to get some good connections, get some good recommendations that can help you apply to other schools. So that definitely would. Those are the three things: location, my average DAT score. If I wanted to do a post-bac or a post program after dental school, those are the three things that really caught me. And then for me, particularly being an African American woman, I wanted a school that had a high rate of accepting African Americans. So Howard is one, of course, Meharry, University of Maryland, Michigan as well is a school that has a high rate of graduating Black dentists. So I looked at that too because I wanted my possibility to be high for me. So I wanted a school that really was into helping the minorities.
That's awesome. So, is there anything that you know now, since you're an established dentist, that you didn't know when you first started out as a dentist, in dental school, that you might want to tell yourself?
No, no, I was. No, I say that because I was a go getter. I was a go getter. Like I knew I was gonna do this. There was nothing else. When I didn't get accepted, I was like, okay, so I'll apply again. And even in my interview at Howard, I said to them, if y'all don't accept me, I'm just gonna apply again. So if you don't take me now, you're gonna take me next year. So yeah, I did, and I think that got me in too. So because I was just so determined. But no, I don't think there was nothing. I feel like my journey was very, very clear for me. Again, when I didn't get in, I took that time to learn more about dentistry. So I was working at the front desk as a receptionist, so I understood insurance. I understood customer service. I understood how to schedule. I understood just having birthday cards for patients, having appointment cards, HIPAA violations. So I learned the front desk aspect of dentistry. So I learned a lot about that. Then I did research. So that kind of gave me an understanding of why research is so important now as a dentist. As far as my treatment planning, why my treatment plan needs to be backed up with scientific evidence. I can't just pull out stuff out of my butt when I'm treatment planning. It has to be clinical evidence that supports why this person needs a crown, why this person needs an implant, why this person needs a bone graft. So that also gave me appreciation of research as well. So I don't honestly, looking back, I think throughout life, I got everything I needed to get me to this point. And there's still room for growth for me. There's still more I don't know. There's still areas of dentistry that I want to push towards. Because I love the career. I really do. I love dentistry. It was every day getting up to work is fun to me. Even the challenges are fun. I enjoy it. So no, I don't think looking back, was there anything I could have told my younger self before I got to dental school or became a dentist? No, there's nothing. No.
How do
Well,
you? Sorry. Thank you
It's
for
okay.
elaborating on that. Another question is, how did you deal with failures or your rejections? It can be stressful for some. How did you deal with that?
Yes. Woo. I'm trying to think about it myself. Um, Failure is a part of the process. It really is. It really is. I mean, I have failed in dental school. Whether I never failed a class, absolutely not. But maybe not getting a grade that I wanted, that I worked my ass off for, and still don't get the grade because the professor don't want to round. I got an 88, and she just don't want to round it to an A. Or I got an 89, and she just, yeah, we're not gonna round it off to an A. So to me, that's a failure because I worked so hard to get an A, and she just refused to give me that point at one point. I think failure allows you to be gentle on yourself when it comes to dentistry, because dentistry is not bulletproof. There's going to be procedures that you do that do fail, and you have to be able to explain it to the patient and not take it personal and think that you did something wrong, or oh man, I didn't do that root canal right, or oh man, I didn't. You did. I'm sure you did the highest quality care that you could have done as a professional, as an educated professional. But things happen. There's things that you don't foresee. Like dentistry is not perfect, nor is life perfect as well. Um, so just being able to be okay when failure happens, because it's a part of life. I think failure has taught me to not be so hard on myself. And when failure does occur, it's an opportunity for you to re-strategize. It's not an opportunity for you to quit. Now, I will say, after failure, give yourself some wiggle room to mourn, to mourn, to be sad, to be upset. Go through all those emotions. Give yourself a deadline. Like, okay, I'm gonna mourn for about a week. I'm gonna be sad. I might not even do anything. But then after that week is over, I have to get up and I have to have a strategy immediately. And that is something you do for yourself. So I always tell people failure is a part of the process. I definitely have failed multiple times, and I felt humiliated to myself behind closed doors. Your family's rooting you on. Everybody's rooting you on. They don't see your failures, but you see them. So I have learned to, fail behind closed doors, but also have like one or two people that support me while I'm failing. And pick myself up. I give myself a deadline to mourn the situation, to be sad about it, to figure out why this didn't work. Where did I go wrong? What can I do better? And sometimes you fail and you did the best. Sometimes you fail and you actually did the best and you still failed. And there's sometimes you fail and you see where you messed up. So you still give yourself that grace period to really mourn and really strategize what happened. But then after your deadline is up, you got to get up and figure it out again. I've had friends or colleagues that have failed exams, and we fail, and then you get up and then you figure out, you study harder. That's the crazy thing. You study harder, and sometimes it's the same information you're studying, but you still have to go harder. So yeah, you have to, and then you have to self-reflect as well. In dental school, same thing. I've had classmates or even myself have failed exams, or didn't get the grade that you worked so hard for. Like I said, I had an 89. The lady did not want to give me a point. Or maybe you did a wax up in lab, or you did a crown prep that you just felt like you did so good on, and the professor just like, nah, I'm still going to give you a C. So it happens. I think dental school would definitely will cause you to actually fail and still give you the strength, and you need that experience to help you in real life as a dentist, because some things are not bulletproof, and then also your staff is going to disappoint you, people are going to disappoint you, things are not going to happen because someone on the team dropped the ball, which is essentially a failure for you. So you have to be okay with being like, okay, that didn't work out, but I have to keep moving.
Thank you, doctors. That was very inspirational. To follow up on that, did you ever consider doing like a specialty or a GPR or any one of those like 1 year residencies for general like dentistry? And if not, why did you decide not to do it?
Okay. So, so when I came into dental school, I thought I was going to be an orthodontist, but then I ended up just loving dentistry all around. And I was like, I don't want to be confined. I have a personality where I cannot be confined to one thing. I have to be like a free lion in the woods. I mean, in the jungle? I have to be a free lion to do anything I want to do. I cannot be confined. So I did not specialize. If I did, I think I would have been an oral surgeon. I definitely think I would have been an oral surgeon. I love surgery. I did an externship in Gainesville, Florida, and I was in the OR room and fixing jaws and TMJs and fractured jaws and all types of stuff, and I loved it. But I just didn't want to be confined in OS. So if I did specialize, it probably would have been OS. But I didn't. I ended up going to Maine and doing AEGD for a couple months. But then because of COVID and the low patient pool that they had, I decided to leave and I started working for Aspen Dental. Do I regret taking the time to do an AEGD? No, I don't. I think all dental students should do a residency program for sure. I recommend it, and this is why. And everyone is different. Everyone is different. Everyone says to get a mentor. Yes, get a mentor. But the reality is, as a doctor, you have to take the lead of your dental education. I'm always the type of person, I am the type of person that I don't need someone to teach me, but I would love someone to teach me, if that makes sense. If you come straight out of dental school and decide to work, you're going to need someone to teach you. But if you come out of dental school, you do a GPR program, and then you come into the workforce, you can have someone teach you, but at the same time, you have experience as well. Does that make sense? Like, without a GPR or some type of continuing education right out of dental school, you're going to be very limited on, one, how much money you can make, on two, on how much production you can make as a dentist. Because if you don't know how to do certain things, not all dentists are here to stop what they're doing to help you. So you need to feel like when you come out of your GPR program or your AEGD program, that you can produce and actually work just as good as the other dentists that are there for 4 or 5 years. You get what I mean? If you come straight out of dental school without any GPR program or AEGD, that kind of puts you at a lower bracket as far as your skills, your interpersonal skills, and your ability to your ability to understand the operations of a dental office. So I think if you do an AGD program or a GPR, they kind of teach you. They teach you all of this stuff. If you have questions, you can still ask, But once you're out in dental, if you're out in the field, you're a full-time dentist, it's kind of a hit or miss if you get a mentor. And then it's just more stressful. It's so stressful. Unless you have an actual dentist that says, hey, I'm going to mentor you, I will highly recommend that you go to an AGD program or a GPR. And then do, of course, CE courses on your own. Understanding how private practice works, understanding how insurance works. If you want to, it's not necessary, but just understanding that you will be in a better space and you will be more competitive as a doctor and more knowledgeable than just going straight out of dental school and into the workforce, unless you have a mentor. What else? I was going to say something else. Yeah. Oh, and then there's always that option of doing a DSO. That's what I was going to say. There's always that option of doing a DSO. With DSO, you do have a lot of educational support. That's why I joined Aspen and Heartland. Whereas if you go to private practice, I've had some colleagues really not have a good experience coming straight out. But then I had some that had a great experience. They had a good doctor to work with. They had a good mentor. But just to save yourself, I would do it's just 1 year that can help and set you up for a lifetime. Why not take that 1 year to get prepared to help you for 20 years of your life? I think it's a good idea. But each his own.
Okay, that sounds great. So another question we have is, where do you see your dental career going in 5 to 10 years?
Just enhancing my skills, doing more surgery. I love surgery. Maybe even practice ownership. I'm not sure yet. I've always wanted to own a practice, but it is a lot of work. And I don't want that to affect my work-life balance. I do feel like I worked really hard to get here. So I do want to also have a good life. I don't want my life to be just work, 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 work. I still want to work and have fun. And I do other things too. I have a nonprofit business. I do one-on-one coaching with young women who want to start their own nonprofits. I do a lot of community work. So my life is very busy. Outside of dentistry, I still do other things. So for me, 10, 15 years from now, I would definitely want to still be doing dentistry, but then also doing more community work, whether it's doing more speaking engagements, more think of helping those that are coming behind me, helping the youth. That's why I was so excited to do this webinar with you guys, because I remember when I was in your position, and it was always that one dentist that came and dropped some wisdom, some good nuggets that helped me push me through. So I definitely want to continue to do that. So to answer your question, I definitely want to still be doing dentistry, but I also have other gifts and visions and other business adventures that I really want to do. I don't want to just be confined to dentistry. And I think that's the good thing about dentistry. For me, coming from a middle-class family, my parents are from Africa. My parents are from Ghana. I was a first-generation child from America. So the good thing is now, because I am a dentist, I have leverage as far as my social back bracket now. So I have an opportunity to not only help my family, but do more things for myself that maybe my parents never had an opportunity to do. So I don't want to be confined to just working hard in dentistry. I would definitely want to explore other things, enjoy my life. So yeah, we'll see where the wind blows.
Thank you, doctor. And in your opinion, what did you find to be the hardest year or time frame during dental school?
Definitely the first year. The first year was the hardest year of my life. And not only did I remember telling my classmates my hair was falling out right here. My hair was falling out right here. My hair was so dry because I didn't have time to go to the hairdresser. My face was peeling because I wasn't eating enough, drinking enough water. My clothes was raggedy down because all I was doing was going to dental school, library, home. Dental school, library, home. Dental school, library, home. I had no life the first year. And, it's a complete adjustment. Trying to figure out your study habit. Then you're meeting all these new people. You got to find a good study group. You got to find people that you can get along with. Then you have different people. People study different ways. You have people that literally just go to class and they don't study at all. There are some people that are studying all day. Then there's some people that are like studying and still going out and partying. There's so many different levels of dental students and like the profile of a dental student. So you kind of gotta. I think my hardest year was my first year trying to get acclimated to all the other students, trying to figure out how I studied. Did I feel comfortable studying on my own? Did I feel comfortable studying in groups? Did I feel comfortable with just doing practice tests or going over the slides? So I think the first year was the hardest year and the most anxiety I've ever had and the most stressful for me.
With that, following up that question, how did you prevent burnout?
I didn't. um, the good thing about dental school it was a cycle. So maybe 2 weeks straight you're studying, then you take your exam, then you can rest for a couple days. And then when I rest, I literally would, because normally I would stay up probably the whole night before the exam. Some of my classmates were like, oh, I need a good night's sleep. I sleep, the day before the exam, they sleep at 8 o'clock. Not me. I studied all the way to maybe 2 a.m. And then I would wake up early that same day to still go over practice questions, any areas that I might feel weak in, right before the exam. That was my study habit. To prevent burnout, I just kind of stayed on a cycle that I would just go crazy for 2 weeks, and then after the exam, relax. After exams, I went to sleep. I never did anything. I literally went to sleep, and then I would try to like do my hair. I would try to look a little decent, because I'm telling you, dental school is stressful. I laugh even with some of my colleagues. I'm like, we didn't know we were pretty until we graduated, because most of the time when you see your classmates, their hair in ponytail and scrubs. That's all we were doing, ponytail and scrubs. And it wasn't until like graduation where you see everybody in makeup and looking nice. You're like, oh, okay, everyone looks really nice. But in dental school, you're like hair in a ponytail, scrubs. You just look at these basic as possible. So to prevent burnout in dental school was to basically be on a good system, know yourself, know when to take breaks. My cycle was based on my exams. So anytime I took a break, it was around exams. So having a good system in place where you know you can relax and it won't affect your studying. Another thing I did in dental school is I studied every day. Every day I studied. At least I looked over some lecture, something. So because in dental school you cannot cram. There's no such thing. So every day after class I would read over a lecture, maybe look over something that maybe I didn't understand in class. I would record lectures too. Some professors I would record their lectures if I needed to. So every day after school I would study for a couple hours before I go to bed. That helps you stay up on your lectures because you cannot fall behind. There's no cramming in dental school. But the good thing, there's maybe 1 or 2 classes you can cram because the workload is not hard. But most of your major classes year, you can cram over time. So having a good system calendar kind of help with preventing burnout. And the good thing, let me just add, the way I was working hard in dental school is literally how I worked out as a dentist. So I feel like you're always thinking, critical thinking in dental school. And literally that's what you're doing as a doctor. Every day you're critical thinking. You're making decisions as far as patient care. And you have to make them confidently and fast as well. But also well thought out plans for your patients. So I really think dental school prepares you and turns you into a doctor and how your day-to-day is. And the same way you prevent burnout in dental school is the same way you're going to prevent burnout as a doctor as well.
Thank you so much, Dr. Asante, for answering the question. Another one is, how long do you usually work as a DSO? And how many patients do you see usually?
Okay. I work 9 to 5, Monday through Friday. Monday through Thursday, and then Friday, 8 to 3. I see about, I want to say 13 patients a day. 13 patients a day. That includes hygiene as well, so you'll be doing hygiene checks. But then you have one column where it's pretty much your big column, so you'll be doing like the root canals, you'll be doing the crowns, if you're gonna be doing implants. Those are like your rock, the things that high production, things that are like severe cases. And then of course you have your checks, your follow-up patients, post-op patients, things that patients want to come in. Emergency patients are coming in as well. So you're seeing about 13 to 15 patients a day.
Thank you so much, Dr. Asante, for answering the question. Another one is, let's say if a patient wants to do Invisalign, do you proceed directly with what the patient wants, or do you input your opinion? Let's say their teeth needs the traditional braces. How would you do that, or would you accommodate with having traditional and then switching to Invisalign?
So that's a great question. I think it's really the thing about treatment planning. It's a little dance that you do with the patient. As a clinician, yes, you are the doctor. You have the educational background, but you also have to see what the patient wants. You have to give them their options. You give them an option of traditional, but then you also recommend what Invisalign, the benefits of Invisalign is as well. And every case is different. Invisalign does have its limits. If someone has a class 3 or an underbite, you definitely want someone like that. In a case like that, they might need surgery. They might not be a good candidate for Invisalign. So you have to do a full evaluation of a patient and kind of let them know what their options are. But also, you're the dentist, so you have the educational background to say to them, no, Invisalign is not going to work for you. Because at the end of the day, you want to make sure they have the best results. So you never want to force a patient to do something. You want to educate a patient and help them in making their decision, but also giving your educational and clinical advice or recommendations.
Okay. So, once you are done um, doing dental school, is there a oral exam and a written exam, or is it just an oral exam, or how does that work exactly?
For dental school, so my senior year, you do have to do your boards. Depending on where you want to practice, you have to find out what state you want to practice in and what board exams do they recommend. So, of course, there's the patient portion where you're doing a class 2 and a class 3. And then there's a didactic portion where you're doing endo and a crown prep, and it's basically on a dentiform. So you have to do those 4 exams, and then you also have a computerized exam. And this is from Maryland. When I needed my board exam, my license for Maine and Maryland. So those were the 4 exams or 5 exams you needed. As far as your last year of dental school, you're pretty much going to be doing any classes that you're taking. You have to take the final exam. You take the midterm, the final, then you pass. And then you have to take those state exams that I had recommended or mentioned. So it's 2 didactic, then 2 live patients, and then the computerized, it's like a computerized 100 questions or something like that. And then there's another multiple choice question as well exam, and it has a part 1 and 2. So it's just a lot of certifications, board exams for the last bit. And unfortunately, I don't remember the names for them. Let's see if I can find it really quickly.
Thank you, doctor. Just to clarify, so I know you went to dental school in a different state and you went back to Maryland. So did you have to take another exam in order to practice in Maryland?
Did Dr. Asante get disconnected?
Yeah, I think she did. I thought it was me, so like I kept refreshing my video.
Yeah, I did.
Sharita, do you want to contact her to make sure she can join us?
Okay. Do I just resend the link or what?
Yeah, just shoot her a text. Just let her know that
She's
she's been disconnected. Okay, there she is. Sorry everyone for the inconvenience. I'm sure it's connectivity issues. Welcome back, Dr. Asante.
Hi. Yes. Okay. How will you ask me? Okay. So for Maine, some GPR and AHD programs, you don't necessarily have to have your license yet. You can work under the attending doctors. But some GPR programs, which is only a few, they require you to have your license. So the board license for Maryland and Maine were the same. So when I got my license in Maine, I was able to transfer it to I was able to apply to Maryland as well, because the exams that they require were both the same. So for example, if you're practicing in Georgia, Georgia has their own license exam that you have to take in order to get your license in Georgia. I think it's the same thing with New York and California. I know theirs is a little funny as well. So once you graduate from dental school, you have to figure out, this is before you graduate from dental school because the process is so long, so you want to get started before you actually graduate in May. So suppose you graduate in May. In March, you need to be figuring out what state you want to be living in. And by the time in March, you're going to know if you got into your GPR program that you applied for. So you'll figure out what state you want to live in, and they will tell you what exams you need to take to get the license in that state. So that's how it kind of works. And it's a long process, and it's a lot of money.
Oh, that's
so
great.
Even when you graduate from dental school, you're still, yeah. So once you graduate from dental school, your license exam, looking at $2,000. You actually applying for your license, you're looking for another $2,000. So yeah, so your last year in dental school, please save money. What I did my last year is I started working my last year in dental school because I had already finished my requirements. Because, you have to have clinical requirements. You have to have an X amount of crowns, an X amount of fillings, an X amount of root canals. I finished my requirements very early my senior year. So my last year, I started working. I was working as a dental assistant in a local practice in DC. And of course, it was good for me because I was still gaining mentorship while I was working. I wasn't making a lot of money, but, I was learning chair side. And even though I already knew that, it was kind of like just for me to be in dentistry, be in my field, and then make a little bit of money. So if you're done your last year, senior year in dental school, if you can work at a dentist's office doing, front desk or being a DA, something, just get some extra cash and help you out there.
Thank you, doctor. And our next question is, does the insurance restrictions hinder you from doing the kind of work that you would think would be the best option for a patient?
In some cases, yes, but in some cases, no. Because my patient pool is pretty much middle class. So, just working class people working for the government. I have lawyers as my patient. I have people that are nurses. I have people that, managers at grocery stores, managers at Walmart. I have a range of patients. Um, my office, we take insurance here, but I know once you become a dentist, you have to figure out what you want to do. Because if you want to be a fee for service, there's a type of patient that goes there. If you want to be insurance based, there are type. When I mean type, there's a profile, like a social and economical bubble that you'll be working with. So you got to figure out what type of group of people you want to necessarily work with. You also want to, because you be doing, for example, there's a dentist that she does holistic dentistry. Insurance companies don't pay for that. So if you're a person that's really holistic living, you're probably working fee for office, which means people are paying straight out of pocket. So you kind of got to figure out where you want to be and put yourself there. My office is insurance based. Um, I don't think it hinders me at all. I think sometimes it does affect the relationship you have with the patient because finances become an issue. And at the end of the day, as a dentist, my job is to provide the highest quality dentistry no matter what. So I'm going to recommend to the patient what I know is best. Their finances, my front desk, they're awesome. They're smart, beautiful women that can help them with that, whether it's financing their dentistry or putting them on a payment plan. We're always willing to help the patient in that area because we know finances is real. Like, finances being a hardship is real, and we are willing to meet our patients where they are to accommodate them and help them along the way and not make them feel overwhelmed. So yeah, insurance is an issue, but you can definitely, if you have a good team, you can definitely still provide the quality dental care. And it's not based on insurance. It's based on you as a dentist. Because for me personally, that's what I do. I provide the best treatment plan, the best that can help them, and the best oral care. I don't allow insurance companies to dictate what I provide my patients. Does that answer your question? Okay.
So, another question I have for you is, what procedure do you find your most favorite, if you have one?
I think extractions. I love surgery, so extractions are my favorite. Yeah, extractions are my favorite. I'm learning to love endo. I'm really good at it. I love endo as well. Implants I love. So I think the top will be extractions, endo, and then implants are my top three. Um, yeah, I think and then actually dentures. I like everything. I like dentures too. Yeah, I love it all. But extraction will probably be my number one because I can get it done in 10 minutes, and then just the relief that you have when the tooth is out and the patient's out of pain is just awesome.
Cool. Thank you so much.
Yeah.
Thank you, Dr. Sante. Unfortunately, that is all the time that we have today and all the questions that we have as well. So we just wanted to say thank you for taking the time to be here with us today, and we really appreciate you answering all of our questions. It's just being really straightforward with us.
I know. I'm a straightforward person. But yeah, I'm so excited. I appreciate you guys. I hope I encouraged you. I hope I encouraged everyone that listens to this video to please not give up. Dentistry, the road to dentistry is hard, but once you get into it, um, the the tenacity that you had to get into dental school will be needed into being a dentist and being in dental school. You're gonna need it. So never give up. Only the strong can get into dental school, and the strong can survive actual dentistry itself because it is a tough field to balance and maintain. I definitely want to come back and do a presentation, maybe just on clinical cases if you want me to. I'm more than willing. I just think I need to make sure I get my HIPAA coverage okay and make sure that patients are okay with me showing their x-rays because it is a process to show their cases and things like that. So I don't mind coming in, maybe doing like a 30-minute slideshow for you guys to just ask questions on case stuff. Yeah, so thank you so much for inviting me. Thank you, Ms. Sharita, for thinking of me and connecting with me. As I am always here for you guys as a mentor for everyone. And if you have any questions, feel free to ask me as well. Yeah.
Thank you so much, Doctor. We appreciate you taking the time and for all those inspirational words. And for everyone who joined our session today, just before we end, the link for the quiz will be posted on our group me. And thank you again, Doctor. We hope you have a great night.